look for any swelling, any bumps, any tenderness. Is that where I touch you? Looking for bleeding. If I find bleeding on his head, he got stuff in his hair. So I get that far. So I get to there. Now I'm going to take, if I have a pen light, which I don't have, but I'll just use an ink pen. Or a marker. So I use a marker, check his pupils for reacting, right? I'm looking for normal size reaction. I'm looking if they're pinpointed. I'm looking at them if they're blown and they're super dilated, constricted. And I'm looking for this. Are they unequal? Is there one blown and there one small for a stroke or things like that? Okay, I get to that point. So I check that. Then I feel the bridge of their nose to see if they may have a fractured nose. I ask them to open your mouth. You look inside. What am I looking inside for? Broken teeth, something blocking the airway, blood, anything I might be looking inside. So I do that. Next thing I'm going to do is I'm going to look in both ears. And I'm going to also look at the nose to see what draining from it. White fluid, which is called central nervous fluid, spinal fluid, that might be leaking out because of a skull injury. If it's leaking out the ears and the nose, then I know they have a severe head injury, and they need to be taken in. Remember the, can I use a nasal pharyngeal airway on him if he has a fracture to his skull? No, that's the contraindication because that can run up into the brain. All right, so I got that. All right, so I checked his head. Now I can also feel the back of the neck. Don't raise your head. To look to see if anything hurts when I touch that area. All right, so now I'm going to get down to the chest area. So then I'm going to press on his clavicles, his collarbones, to see if they might be broken. I'm going to push down his chest, push in this way, go this way. What am I doing that for? Fractured ribs. So that's what I'm doing, is checking to see if I'm going to find that. So then we get down to a little bit further. We're going to get down to the stomach area. There's 4 areas of the stomach that I'm looking. So left side, right side, lower left, upper left, lower left, upper right, lower right. So then I'm in the area of his stomach. So then I push here, I push here, I push here, and I push here. If you ever had appendix and somebody touched you on that side, what do? It hurts like crap, and then you're just like screaming because it's a rebound. You guard yourself from doing that. I'm also looking for, on this side, if this is tender on this upper left, what am I looking for? Huh?
Is it spleen?
Spleen, right? Traffic accidents, if you're the driver, bam, they hit the side of my car, the door hits me right in there. And so, or if you're a football player and you're the quarterback and I'm throwing like this and guy hits me right there, damaged, ruptured spleen. Okay, so if they're pain over here, that's the liver side. Then, and like I said, you're looking for these areas. I'm also looking for soft stomach, right? If it's super hard, if it's super hard, what am I looking for? Bleeding. Because as the stomach fills up with blood, it fills up that chamber and makes your stomach rigid and hard, that where it should be soft for me to touch. Okay, so I've got to check those areas. Then I'm going to check the pelvis area. So if I push on his pelvis this way and I push in like this, then I'm looking to see if he has fracture of the pelvis. And you push down on the pubic bone area to see if they have fractures that could be up inside, which can happen from the impact of you sliding forward on a car whatever you're doing, it can fracture all this area. I don't know if I showed you guys the picture of the guy that rides his feet up on the dash and get into a head-on, and as the car dash rolls backwards, it rolls this pelvis, this femur bone, up out here, up inside your stomach cavity, and this one's up inside here, the other one, because it breaks off both of the sockets. Okay. All right. So now I'm going to be working my way up to the arms and the legs. So if I'm at the legs, also, what else am I checking here? If I'm checking here, pulse, right? What's it called? Femoral, or femoral. If you say femoral, I don't care. Femorals. I want to make sure you have a pulse on this side and a pulse on this side that's going down, so that I don't have to worry about circulation down in the legs. Okay, so then I get to the legs, then I press and I'm feeling for any deformity. I'm looking for bumps, tenderness, and bleeding. I'm going to check the right leg. I'm going to look for bumps, tenderness, any bleeding. You might feel that through their pants. If you have a severe patient, what am I going to do to them? Gunshot wounds and stuff. What I'm going to do? Strip and flip. Remember modesty. Modesty means that if I have even a male or a female, put sheets around and protect the modesty of your patient, then stripping them down out in the middle of everybody to see them. Okay, so I got the right leg, so I'm looking right at the left leg, look for bumps, tenderness, bleeding. Okay, push against my feet, my hands. Okay, push, pull back. If I have their shoes off, what am I going to check for? I would be checking for reflex. Okay, see if you got movement and those. All right, so I go there. Now I go back up and I can check their arms for bumps, tenderness, bumps, lumps, tenderness, bleeding. All right, take my hands, squeeze, okay, push, hold them up like this, push against, pull it back. You're checking the spinal to see if they have sensation in their nervous system. All right, now I can slide over a little bit. There you go. All right, so now I'm going to try and turning, and then I'm going to feel for bumps, tenderness, or bleeding. Okay, that's what you're checking for, and you're also visualizing. If I have a gunshot victim to the front, does he have exit wound? Right? Maybe, maybe not. So that's what I'm looking for.